Hi everyone. Welcome everyone. I am Dr. Arjun. I'm the head of physiotherapy and aquatic therapy department in Neurogen Brain and Spine Institute, Navi Mumbai. Let's discuss the basic concepts of aquatic therapy, the interesting facts about aquatic therapy, and how aquatic therapy can be useful for the patients in fighting their disability. Okay. So, what is aquatic therapy? Aquatic therapy consists of goal oriented exercises that are performed in a therapy pool under the supervision of a trained aquatic therapist. So, aquatic therapy is the use of water and its physical properties to perform specifically designed activity given by qualified personnel to aid in the restoration, extension, maintenance, and quality of function for persons with acute, transient, or chronic disabilities, syndromes, or diseases. And there is a bit of confusion regarding aquatic therapy and adaptive aquatics. So the difference is often it is there's a confusion that whenever a child or whenever a parent come for aquatic therapy, they misinterpret it as swimming. So which is not the fact. So adaptive aquatics is the process of teaching people with disabilities how to swim safely in the water. So that is a separate field. But what we are looking at through aquatic therapy is an entirely different aspect of rehabilitating the patient. So, but managing and controlling the body in water may be able to the swimming part will come in between when we are treating the child, and but that is not the focus. So, adaptive aquatics is entirely a different field, and aquatic therapy is something entirely different. Going to the history of aquatic therapy have a very long history because throughout the ancient civilizations, we are aware that pool was something which was used for relaxation and bathing, all these kinds of things. So we know all the kings or the queens in palaces. There were a specific spot for a pool, an indoor pool, sometimes an outdoor pool. They all used the pools for relaxation and certain activities. So hot springs also. Hot springs, there is a lot of hot spring in and around the world, right? So the Greeks and Romans also used the bathing in hot springs and various therapeutic benefits. The second, these points which we have noted here is the milestones, only the main important things in the history. The second one will be the about the US president, the 32nd US president who had polio. His name was Franklin D. Roosevelt. He in 1924 he had used water therapy, and he understood that his legs could support the weight of his body when they could not on land. And there is another major milestone is in Japan. There was a hot spring called onsens. So a lot of people used to go to the hot spring onsens to relieve stress, muscle pain, and other ailments. And late in the 19th century, it became more popular. European spas began to treat locomotor and rheumatic disorders. And the concept of hydrogymnastics started after that, the closest forerunner of the current aquatic rehabilitation concept. And in 1928, Walter Blond described the use of Hubbard tub. So there was a water tank larger than the size of a whirlpool bath. Whirlpool bath was used earlier also, but this was bigger than the whirlpool bath, and this was specifically designed for patients and for therapy purposes. And by mid 1900, in Europe, two major aquatic techniques were formed, which was Badraga's ring method and the Halivic method, which is the which developed the current aquatic main the main stones of current aquatic rehabilitation protocols. So from there, aquatic therapy evolved year after year, and a lot of types came up. Then a lot of varieties came up. It spread all around the world to the to a level where everybody is like most of the therapists all around the world are using aquatic therapy to treat their patients. Here we have to discuss about the properties of water, which is mostly physics. But when aquatic therapy is concerned, when we are speaking about water, we can't go forward without speaking about the properties, the physical properties of water. So this is a small revision of what we have learned in our schools, but just we will just quickly go through this. The first property of the water is that it can take shape, it can take any shape or any form. Water can be gaseous, water can become solid as an ice cube, water can be fluid like flowing in a river, and it can also take the shape of a container. Whatever containers has the shape, it can be a round shape, it can be a square shape, it can be a tube shape. So according to the container shape, it changes its shapes, right? Next property we are discussing is compressibility. So water is said to be having very low compressibility. It is assumed as incompressible, and changes in temperature and or pressure really don't change the density of water. When other fluids are concerned, when the temperature is raised, the density is altered, the density increases. But in water, it doesn't happen. This is a unique feature of water. Next one is the cohesion and addition properties of water. Cohesion is the property of the water molecules that stick to each other, and this is the property which offers resistance when we are in the pool, when we are moving our hands or legs. This is the property which gives resistance to the movement. And addition, the next property, is the adhesive property with the water molecules to other surface. Addition between glass or water are stronger than the cohesive forces. Next property we have to speak about is surface tension. So water is supposed to say that it water has a high surface tension of 72.8 millinewton per meter at room temperature, and that which is caused by the strong cohesion between the water molecules. So because of the cohesion, water stays together as a drop on a non-absorbent surface. So when we put water on a non-absorbent surfaces, all the water molecules will stick together as a drop. And this is the property which we speak about surface tension. Next property is the buoyancy, the most important property which help us a lot when we are treating patients in water is buoyancy. Buoyancy, we have learned about this in our schools about Archimedes principle. That is, whatever the object is, any body which is immersed in water, partly or fully, the body will experience an upward thrust from the water, and this is a force that is in opposite direction of gravity, and the water will push the object and try to displace the object. So the so we know that the gravity is always a downward force. Whatever object is on land, gravity tries to pulls the objects downward, and whenever a body is inside the water or on top of the water, the buoyancy pushes the body upwards. So both these forces are opposite in direction. Next property we are discussing is viscosity. very important property of water. So even though water has a adhesive property, the viscosity of water is less compared to other fluids. The viscosity of the water is 1.0 centipoise, where the viscosity of honey is 12,200 centipoise. So whenever we are in the water, the movements are possible because of the water's low viscosity. Even though water have cohesion property, which offers us resistance to the movements, but at the same time, because of the low viscosity of the water, it promotes movements in the water. For example, if we were in, we can't perform any exercises in, you know, any oil, any kind of oil or in honey because it has very high viscosity. It will restrict the movement. Another property which is important to us is water as a solvent. It's diffusion properties of water. Any substances that will mix well and dissolve in water because of its high polarity. Salts are known as hydrophilic and other substances, while those of that do not mix well, like fats, oils, are known as hydrophobic. This property is important because we are treating patients in water, and it is important for us to maintain the hygiene of the pool. So we have to add certain amount of cleaning agents like chlorine, baking soda. So it is important that it shouldn't be visible or it should dissolve quickly when we are adding those substances into the water. There are other liquids which doesn't have as much as diffusion property as water. So since water has high diffusion property, we are able to, add these chemicals into the pool without altering a lot of uh, clarity or visibility of the water. Next property is specific gravity. Specific gravity is, sorry, specific gravity. So um, specific gravity, we compare the specific gravity of all the objects with that of water. So the specific gravity of water equals to 1 at 4 degrees Celsius. And all the objects which has density which is higher than that of water will sink in water, and which has less density than that of water will float in the water. So that's why human body has a specific gravity of 0.974, and with males averaging higher density than females. And because of that, the human body's specific gravity is less than that of water. We are able to float on top of the water. But the unique property in about water when specific gravity is concerned is the property of ice cube. Why ice do float? So it's an unusual property. So whenever so water has the unusual property of becoming denser above its freezing point. So water is denser when it goes above its freezing point. So typically, when the ice cubes are supposed to sink when they are frozen and become denser, but they do not. They float. So this is the unusual property of water, unusual property of specific gravity. Yes. So next slide is about hydrostatic pressure. So hydrostatic pressure also we have learned about this. It is the pressure exerted on any object which is immersed from all the surfaces. On all the surfaces, there is a pressure exerted horizontally. And this immersed body thus has fluid pressure exerted on all surfaces. and water exerts a pressure of 22.4 mm of Hg foot of water per foot of water depth, which translate to 1 mm Hg per 1.36 centimeter. So this is the force that aids in the resolution of edema in an injured body part, right? So when we are just immersed in water, water is able to provide this much amount of pressure just by we being in the water. So hydrostatic pressure, which is very important. Next is metacentric effect. This is also very important in the rehabilitation point of view. Metacentric principle is concerned with balance in water. So we already discussed that gravity is pulling all the objects towards the ground, and buoyancy is pushing all the objects upwards in water whenever we are in water. So a body immersed in water is subjected to two opposing forces, which is gravity and buoyancy. And when there is these two any imbalance in these two opposing forces, there is a rotation taking place. So if the forces of gravity and buoyancy are unequal and unaligned, then movement occurs, and the movement is always in is a one of a motion. So either in mostly a rotation which happens. So which we use this metacentric effect to give imbalance to the body and to activate certain group of muscles, or to train certain movement patterns. So metacentric effect, when the imbalance happens and the body has to if the body has to stay still, it has to be aligned. The opposing forces has to align, and the body has to do that adjustment to make it equal. So this is also one important um, property of water which we use in the rehabilitation. Next one is turbulence. Turbulence is a fluid motion characterized by chaotic changes in pressure and velocity. So Bernoulli's theorem, which is concerned with the relation between fluid pressure and fluid velocity along a streamline in the steady flow of frictionless fluid, which has a constant density. Part of the theorem is an expression of energy, total energy of a particle of water of any moment is the sum of its kinetic is the pressure energy, potential, and kinetic energy. So every fluid which flows has two type of flow, which can be turbulent flow and laminar flow. So the degree of turbulence will depend upon the speed of the movement. So if the movement is slow and the flow of the particles is almost parallel to the object, then the proceeds in a smooth continuous curves, like here on the right side. The laminar flow, the object, the movement is slow and it is almost parallel. The, the flow is parallel to the object. But when there is a faster movements, then it becomes turbular flow, turbulent. So faster movement produce eddies and energies, and in the eddies is dissipated, reducing the pressure and increasing the drag on the body. So when there are the turbulence is the flow is in different directions, the water will pull the body towards it in opposite directions, which will create a lot of imbalance, which will create a lot of instability to the object which is in water. We use turbulence to challenge the balance, to challenge the walking, also to give a weight bearing to a particular side when it is required, to encourage weight bearing on a specific side, or to balance anteriorly, posteriorly. In such aspects, we use turbulence as a therapeutic material. So mostly the physics part is covered. We'll just speak about buoyancy and joint unloading. The body is gradually immersed. Water is displaced, creating a force of buoyancy. We already spoke about this. when a person is immersed to the pubis, there is offloading up to 40% because of the buoyancy. And whenever he is immersed up to umbilicus, there is 50% of offloading of the joint. We'll explain this very easily in this picture. We can see up to the waist, there is 50% of body weight reduction when the body is immersed. And when we are immersed up to the xiphoid process, almost 60-75% is the body weight is cut off. When we are submerged up to the neck level, almost 90% of the body weight was taken off. Now, what is the limitation of land therapy, and why do we have to take the patients in water, which is very important because we already take a lot of patients on land. We already see patients. We use a lot of techniques, different types of techniques in neuro rehab. Then there are some limitations for which we can use the properties of water and treat them more effectively in water. So these limitations are gravity. It makes more difficult on land. Gravity pulls the pulls whoever is on land the to the ground, and we experience a lot of body weight on land. Managing body weight is difficult. There is a lot of fear of fall, and whenever we fall, there would be an injury. And most of the population, like even children, adult, all kind of population are afraid of fall, and that is something we can't really, you know, we can aid a lot of support, we can give a lot of stability, but still the fear of fall, which is innate in every human being, we can't really completely ignore it, or we can completely nullify it. And whenever somebody is falling on land, there is very less time to compensate or to react. Increased joint compression while performing movements is also some limitation, and on land it is becomes very energy consuming. So in the picture you can see there is a female. She's a case of stroke, and there are four people around her to support her, and still she is not able to stand straight. So that is what water therapy can do. I don't have any picture of the same person when I'm discussing about the benefits of pool therapy, but I can definitely say that if she's in the pool, I can single-handedly support her and make her stand in the pool if she is submerged at the level of her chest. So that is the benefit. That's where the benefit of pool therapy starts. So it advantage the minimizing the effect of gravity. Strengthening becomes easier in the water. Fear of fall is less because there is more time to compensate for a fall. We don't quickly fall in water. We get a lot of time to react. So which boosts the confidence, and the person can try by themselves to anticipate a fall and to come back to a neutral position, which is very important. And what is also very enjoyable and consume less energy. Let's discuss about therapeutic advantages and benefits of water. And firstly, we will discuss about the advantages which are very specific to the water. So first one is because of the supporting effect of water, it is often possible to facilitate more distally, therefore allowing more opportunity for the client actively to be more actively proximally. So we will be supporting the patient from the patient distally, and there is a lot of proximal work happening in the client. The other thing is internal stability. The client has to develop internal stability. They can't really use other objects or other person support or anything when they are in water. They have to work on themselves with their internal stability. They have to use. So the compensation becomes very less when they are in the pool. And the movement in water is slow. We already spoke about this, to regain balance when they are falling from their erect position. They get a lot of time to react. This will contribute to the development of independence. So whenever on land, when a patient falls, we hold them and there is no work happening from the client side. But in the pool, they get a lot of time to react, adjust themselves, make them align, bring back their stability. So there is more independence and there is more work from the patient rather than the therapist or the people around. The asymmetry and associated reaction induce unwanted rotations in water. So whenever a patient is in the water, and if there is the stability becomes possible only when the child or the patient is completely aligned. Even there is a little bit of malalignment. There would be a rotation happening in the pool if he's submerged properly. So they need to move differently to bring back their alignment, which gives them a purpose to make their alignment better, which is not possible on land. And on land, with all the compensation, they can sit, they can stand, they can walk, nothing happens. So an abduction, external rotation, extension of the limbs facilitate balance in supine in water. When we are floating on the water, these are the movements which gives stability for a patient. And these are the movements which we often try to promote in clients with typical pattern of hypertonic, like in CP, stroke. So automatically this becomes encouraged whenever we are in water. And it is often easier once in water to handle the patient or the larger clients. Like even for a patient who has 150 kg, 180 kg, single-handedly a therapist can handle in water, which becomes very impossible on land. We need at least 4 to 6 people to handle a client who has or any equipments which can offload the joints or offload the weight. Therapeutic advantages of water. The next one is the learning of some activities can be initiated more easily in water and can be further developed on land. For example, balance on standing and learning to blow as a preparation for oral communication. So standing becomes easier on land to how to weight shift, how to transfer weight from anterior to posterior, posteriors to posterior to anteriorly, sidewise, all these things. And balancing becomes easier in water because it gives a lot of support and offload the joint. And later we can take the patient out of water gradually and it becomes easier for us to train. Group work also becomes it's promotes social skills, turn taking, communication, and opportunities to play and competition. Working in the water can bring variety, challenge, and motivation for the client and sometimes for the therapist, especially in long-term rehabilitation. We all know about these points. Treating a patient for a longer term, like 3 months, 6 months, becomes little challengeable for all of us. But if we mix up it with aquatic therapy, it becomes very interesting. We have a whole set of goals and activities we entirely different, which we do on land, so that it doesn't become monotonous. Now we'll speak about the benefits overall. So there are decreased abnormal tone, increased range of motion, enhanced proprioceptive input, improved balance, decreased pain, improved functional mobility, improved strength and aerobic fitness, and enhanced psychological mood. We'll go to one by one to all of these points. Decreased abnormal tone. Immersion in water decreases weight bearing. Decreased gravitational loading has been noted to decrease tone. No explanation needed here. Gravity is cut off and it will it is supposed to reduce the tone. And gentle increase in vestibular stimulation causes a decrease in muscle tone. According to therapy techniques, there are rhythmical repeated movements and trunk rotations, which can aid to reduce the tone. And warmth of the water. Whenever we taking the patient, we take in a higher temperature. So it will also aid to reduce the tone. And also there are techniques like Watsu, which will promote a lot of relaxation, which will reduce the tone. Increased range of motion. Buoyancy assists the movements towards the surface of water. Buoyancy supports movements parallel to the surface of water. Active aquatic exercise program have been shown to increase the range of motion. And passive range of motion, neurological disorders are often accompanied by increased tone and decreased usage that lead to connective tissue restrictions. When muscle tone decreases, stretching and soft tissue mobilization techniques are more effective and the patient gains more mobility. And the warmth also encourages to reduce the joint stiffness and to improve the mobilization techniques. So the patient gains more mobility. Because of the properties of the water, the buoyancy mainly, the range of motion becomes easier and has enhanced proprioceptive input. So buoyancy tends to decrease proprioceptive input during static standing secondary to decreased weight bearing. Movement through the water is affected by viscosity and turbulence, which exerts a lot of pressure on our joints or on our body. Water is more viscous than air, so there is more resistance to flow. Therefore, more force is required to move through water than through the air. So whenever we are on land, there is only air where we have to cut through. So air's viscosity is less than that of water, so movements are easier on uh, on land. But water gives a more proprioceptive input. Next one is improved balance. We already spoke about this. Patients' movement errors can be corrected very easily because of buoyancy, because of the joint unloading. Therapists can permit patient to move their center of gravity outside their base of support and learn to correct the error safely with less guarding by the therapist. And buoyancy and viscosity of water provide a safe environment for patient to practice movement with less fear of falling. Progressing patient into shallower water allows them to gradually progress into a full weight bearing environment. So whenever we are training initially for somebody who cannot really stand at all, so instead of using a lot of calipers, a lot of assistive weights, a lot of external supports, we can just take them into water. If the patient is, we know if the patient is neck level immersed, then 90% of the body weight is gone. Not gone, actually, we are cutting it off by buoyancy. So from the 90% of water, the patient can stand with maybe with very less assistance or no assistance from the therapist, or with corrections or cueing from the therapist. Gradually, we are supposed to take the patient to shallower part where, so that is a progression where we give more loading and then there is more muscle work. So it is the progressive technique when we strength when where we can strengthen the muscles as well as we can improve the balance and the functional activities in a patient. Decreased pain. The warmth of the water aids in decreased pain. Warmth of the water coupled with specific aquatic therapy techniques helps to decrease tone, thereby decreasing muscle guarding and spasticity. This helps to improve blood flow into tissues and further decrease pain. Improved functional mobility. The aquatic environment allows patient to be successful with functional activities such as transfers and walking earlier than these skills can be performed on land. This is due to the buoyant support of the water and the reduced tone and increased range of motion that are result of aquatic therapy techniques. Patient is able to acquire upright postures earlier when they are in the water, which becomes very much exhausting for the patient in initial stages of their rehabilitation. Patient can take greater risk with higher level activities, especially quick reciprocal movement patterns and challenges to balance. Support of water can also provide greater ease of handling for the therapist. It becomes easier for us also. Correct water depth is important for each patient at each stage for her or her rehabilitation. Otherwise, this becomes difficult for us. So, like if we are treating any patient in water and it is if we are feeling a lot of patients weight on us, then either we are not immersed properly, or the patient is not immersed properly, or the depth of the water is not accurate. Improved strength and aerobic fitness. Aerobic and strengthening exercises are vitally important in the treatment of population with neurological disorders. Water provides a safe environment where patients with neurological disorders can work to increase both strength and endurance. Because water provides resistance as well as it supports movements. We can improve the strength also, we can improve the endurance also. Enhance psychological mood. We know water gives releases more endorphins, which is called happy hormones. Nobody's in the pool, nobody goes into the pool and who are not like really happy. Everybody goes to the pool, we become happy. Pool is always associated with happiness. So decrease fear of movement due to buoyant support of water, success with voluntary movements that are not yet possible on land. Success often leads to increased motivation and self-confidence, increased opportunities for socialization, exercise, and recreational activities. So independence becomes a very important aspect of enhancing the psychological mood, because there are a lot of patients, a lot of children who are non-ambulatory, but who are able to move independently in water. Maybe because of their disabilities, deformities, because of their body weight, they becomes completely dependent. They become wheelchair bound. They become bed bound. But these children, once they are in the pool, they are able to swim by themselves. They are able to move by themselves without any support, which boosts their confidence and independence a lot. Moving forward to the aquatic therapy techniques, there are majorly four aquatic therapy techniques which we use. The first one is water specific therapy, second one is Badraga's ring method, third one is Aichi, and the fourth one is Watsu. We'll go to one by one. First one is water specific therapy. The Halivic concept was first formed by James Macmillan. Halivic as a concept was originally developed to teach clients with physical disability to swim and to make them independent in water. Halibi concept uses a lot of rotations and the usage of metacentric effects, which we spoke earlier. Halibi concept helps in postural control, balance, movement, and strengthening of muscles. 10-point program, which is a major concept in Halibi concept. The 10-point program is a motor learning sequence that focuses on postural control to teach swimming. Which has three steps, which is mental adaptation, balance control, and movement. We'll quickly go through the 10-point program. You can see in the table here. So there are three phases on the right side: the mental adaptation, balance control, and movement. So mental adaptation includes mental adjustment and disengagement, which includes introducing a person to the pool for the first time, making them comfortable in the pool, acclimatization, and then disengagement. Disengagement means that the child or the patient is disengaged from the therapist. Without the support of the therapist, they are able to move inside the pool. And then comes balance control, which includes the rotation: sagittal, vertical, lateral rotation, combined rotation, upthrust, balance in stillness, and turbulent gliding. So these rotations, uh, normally on land, we know the rotations are termed in the uh, there are sagittal rotations, vertical, and lateral rotations. So in the pool, we are termed these rotations are termed in terms of the plane. So sagittal rotation happens in the sagittal plane, vertical in the vertical plane, and lateral in the lateral plane. So I will show some activities in the next slide where these rotations are explained. So these are the balance control. So mainly these balance controlled rotations, upthrust, balance in stillness, turbulent gliding, these all are part of gaining the balance inside the water. And the last stage is movement, where there is simple progression and then basic halloween movements happens. So to explain transverse rotation, this is a picture of a patient lying in supine and comes to sitting, supine to sit, and then goes to prone. So this is the transverse rotation in water. Next one is sagittal rotation, which is a side-to-side movement. So the client moves from the left side to the right side or from the right side to left side. So it can be so the transverse rotation also can be brought into pieces, or we can reduce according to our requirement of the movement. If I want a person if I want to train a person just to do sitting or to supine to sit, I can only bring them up to sitting. It is not necessary that I complete the full movement, but the movement is in transverse rotation. Sagittal rotation, where we activate a lot of the muscles on our lateral chain muscle groups. This also helps us in achieving dynamic setting balance or reaching in standing, also in weight shifting from the left to right or right to left. So this all can be used on these aspects. Horizontal rotation, when you can see in this first picture, the child is in supine and he rotates from one side to supine to prone sideways, which is horizontal rotation. Horizontal rotation can be used for to train turning, rolling, and yeah, all these activities. So the support in all these rotations changes from patient to patient according to their requirement and according to their muscle strength. We can so this particular in this particular slide, I'm not giving any support to the child because he's able to sorry, he's able to do it independently. But for somebody who needs assistance, we can give the support and reduce it gradually so that he learns the movement and uses his muscles more. The second technique is Badragas ring method, and this is completely based on PNF principles. Here we use a lot of floaters. Basically, three floaters are used: one at the neck float, and the second one at the waist, and the third one at the ankles. And the extremities also can be used if required. But these three floats are mostly used, widely used. So BRM, there are specific patterns of movements, and this is to used as a strengthening program or mobility. But this is very systematic. When Halovic is concerned, there is no systematic approach. We have to go from this exercise to this exercise to strengthen this particular movement. There is nothing as such. We can start anywhere, we can end anywhere. But BRRM, there are systematic techniques to strengthen each movements, like PNF principles only. There is D1 patterns, there are D2 patterns. For that pattern, we have to hold here only. We have to the handling should be in this way. We all know that. This the same way Badraga's ring method has specific set of group of exercises, and there are key points where we should hand handle the patient so that the results are accurate and we gain the proper strengthening of the muscle groups. Third techniques is Aichi. Aichi was developed in 1993 by Yun Kono, owner of the Aquadynamics Institute of Yokohama. Aichi includes a lot of series of continuous slow and broad movements accompanied without force combined with deep breathing. Aichi is mainly an active technique, and it is a relaxation techniques. It helps in prevent fall prevention, mobilizing connective tissues. These are the basic IHG postures. You can see from the first picture to the last picture, there are specific set of movements. Arm closed first, then opening the hands, then lifting the hands sideways and bringing them down, then moving the hands to opposite directions. So there are specific set of movements in IHG postures. So it is very helpful, but it is mostly active. The other technique is Watsu, which is a completely passive relaxation technique. It combines elements of massage, joint mobilization, muscle stretching, and movement. You can see this. The clients are like mostly they are sleeping. So it's a passive relaxation technique. The complete work is for the therapist. There are specific way how to move. We also use Watsu floaters. You can see on the thighs here floaters are put. On here also there are Watsu floaters are used. But this is a passive relaxation technique. The client doesn't have to do anything. Where in Halivic, the client has to do. There is a lot of work for the client. In BRRM, there is client. Their major work is for the client, but the therapist also has to properly guide the patient. In when it is IG, it is mostly active. It can be supported also, but it is mostly active. Third one, Watsu, is a completely passive technique. Now, coming to the benefits of aquatic therapy in autism spectrum disorder or attention deficit hyperactivity disorder. So, we have found that children are more focused and follows more commands when they are in the pool because every child likes to be in the pool, likes to play in the pool. Most of the times, the land therapy becomes boring to them, monotonous to them to sit in a place and do activities. But in water, they are able to follow more commands because they likes to be in the pool. It's like an enjoyable medium for them. So we have to incorporate activities based on their disabilities or their impairments and make the use of water and make them do more activities. So that is in our hands. Next one is improved multitasking. When the child is in pool, there are multiple functions, multiple systems functioning at the same time. Like whenever whenever his child is in water, just standing, he has to he can't just stand. He has to balance. There is a lot of imbalance happening by the water, the flow of the water, or the movement of the water. So he has to balance. If he has to walk or lift his leg, he has to work against work against the resistance of the water. So he has to do a lot of planning with each steps so that he doesn't fall or he doesn't uh, get imbalanced. And plus these, we incorporate other activities like in the picture we are doing ball throwing, ball catching, or we ask them to do certain activities, sorting activities, certain balancing activities. So at the same time, there are multiple systems functioning. There are multiple tasks where the child has to do. It also found to reduce hyperactivity. Most of the parents have reported that after the aquatic therapy, their children are more calm. This is not just because of one session. It happens longer term also when the children are going into the pool regularly, like for a year, for 6 months. There are some impacts on their hyperactivity levels. Improve speech when they are in the pool. There is need of more use of automotor functions to control their breathe. They have to blow. They have to spit. So these all things improves their automotor functions, which will improve the speech. Physical functions, of course, when they are working in the water, they have to work against the resistance of the pool. They have to, the challenges their balance. So there are physical benefits also. Concentration, focus, attention, all can be improved in the pool with certain activities. Like here in an activity, this is an underwater ring. which will sink, and the child has to lift the ring. So here the child is attempting to lift the ring with his legs because he is not comfortable going down. He's not comfortable water touching on his face. So we didn't. So I didn't tell him to take the ring with his legs. So that is his motor planning. He did the planning by himself. He found a way to do that by himself without going beyond his comfort level. But ultimately, he will learn to go down. He will get comfortable, and he will try to take the ring by his hand also. So this activity, when something is underwater, we have to be very concentrated and attentive to pick up, because there is refraction is another property of water we didn't discuss. Refraction is where the something under the water can be not on this that particular place. Like when we look from outside the water, it can be at another place, but it is somewhere else actually. So the concentration attention part is very important here for the child to go down and pick it and come back. Sensory benefits: water exerts a lot of pressure on our joints, on our all the parts of our body because of hydrostatic pressure, which gives a proprioceptive input, tactile input, and vestibular. A lot of vestibular feedback is we get in water because of the buoyancy. Children can jump around the pool, jump in and out of the pool without feeling a lot of weight, and it calms the senses of the body. Now, coming into the diagnosis, cerebral palsy, we already discussed that how water can be helpful to reduces the spasticity or dystonia. There are certain techniques like Swatsu, which encourages passive relaxation. Improving core muscle strength in cerebral palsy is an important aspect. Here, I am doing a strengthening of the upper abdominals, where the child is supported from the waist and his knees are locked in between my knees. I'm asking the child to come up and to come up into the sitting position, where I'm targeting on his upper abdominals. Here, we can improve the challenge of the child by going more distally. So if I'm holding him from the axilla, it would be very easier for him. If I'm holding him from the waist, it will be the most challenging for the child. Also improves functional activity of hand with the warmth of the water and easiness of the movement in water. Hand opening in such patient clients has been seen easily, and it can be trained easily when the child is in the water. Cognition is also improved. We already discussed about all these cognition aspects in the autism slides. Muscle strength and voluntary control can be easily we can be targeted during Halvik, Badragas. Walking pattern and gait can be improved. What so when walking pattern is concerned, whenever somebody's in water, with the next time when you go to the pool, when you're just walking in the water, just observe your gait. So whenever somebody is in walking in water, there is a more amount of hip and knee flexion which is happening. In the photo, you can see it's a normal walking. They're just walking normally, but there is no increased amount of hip and knee flexion, which we need in most cases like CP or stroke. We need more. We are focusing on more hip knee flexion. So the gait patterns can be easily achieved if we are trying to make the child or the patient just by walking without doing nothing, you know, no specific technique or something. We can achieve a lot of things. Stamina to walk and do more exercises can also be improved. Aids in respiratory and oromotor training. There's a lot of oromotor exercises which we can incorporate in water, like blowing onto a ball like this. This is called an egg flipper, which flips. So the upside has a one color and the lower side has another color. If you blow properly, the egg flipper will flip to the second color. Bed mobility activities can be trained like turning, rolling. In the picture, the child is doing a turning and this the same activity. If the child has a difficulty in turning or rolling on land, I would go for this specific rotation, which is longitudinal rotation. Sitting balance, standing balance, and walking balance can be promoted in water. In the first picture, I am trying to challenge his dynamic sitting, and he has to use his core muscles a lot so that to balance his body. In the second, the child is trying to achieve his standing balance without my support. The same child on land requires minimal assistance or cane support while standing or walking. Now, there are certain challenges of initiating neurodevelopmental children in the pool, which are sometimes introducing the child into the pool becomes a very long process. Some children are severely hydrophobic. They don't want to get into the pool at all. So I have seen some children who doesn't like water on their face, who doesn't, even when while they are bathing, they are not comfortable with water coming on their face. So taking such children to the pool becomes a tedious task. And some children are very overexcited to be in the pool, or they don't get out of the pool at all. So that also becomes a problem. Like even after the session, we have complete like packed sessions, one after another, one child after another, and one child is not ready to come out of the pool after his time. We have to like really waste a lot of time for from the other child, the next session. So that is also challenging. At times, the introduction part may take 1 day to 3 months or 6 months to make the child comfortable, be around the pool, be in the water, or you know, uh, water coming on their face or body. But the important thing is never to force the child into the pool or into underwater, especially, which is very dangerous because there are some children who has some accident or some traumatic experience in the water, but after which they are not ready to come into the pool at all. So we should not try to create such traumatic experience for children by introducing them to the pool. It should be very gradual, make them comfortable in the pool, step by step, make them sit on the deck of the pool, then introduce them. I'll show you a small video in the next slide. So yes, and at times introduction and acclimatization itself becomes a goal for a week or a month. So this is the video. Let's see. Let's watch the videos. The first session is where I'm introducing this child into the pool. This is a 5 minutes video. I have increased the speed, and so yeah. So I'm introducing the child here. He's not willing to come into the pool. So somehow I managed to make him sit on the deck of the pool, and I'm asking to come into the pool, but he's not. So I am making him comfortable by splashing water on his legs, on his hands, and making him understand that water is friendly, that it doesn't is not gonna harm him anything in any way. And so initially, I'm not trying to pull him or force him into the water. I'm making him more comfortable. I'm keeping his hand on my body, trying to take him slowly him to the pool, but he's still refusing. But I give him time to become comfortable, to enjoy himself touching the pool, understand. But he wants to come into the pool. That's why he is sitting. Otherwise, he would have run away. So somewhere I will have to take him into the pool. And this is almost 5 to 7 minutes of video, which I have cut at specific parts and reduced the timing. I'm trying to give him more confidence. That's what we are talking about. It's a long process. It can't be achieved like in a minute. You pull the child directly into the pool and give him a fearful experience. Once I'm sure that he is ready to come, then I'm slowly taking him into the pool. But still, he somehow managed to grab on the railings through with his legs, where I needed some external support, and then he's in the pool. So once he's in the pool, he's still afraid, but then he's okay. Now this was the first session. Now we will see him in his third session, where he is completely disengaged for the first time. He's able to move through the water by himself. He is doing his activities. He's not afraid anymore. See, so that is the difference, and that is the the process where we have to go. It can take a lot of time, but that's a challenge for us. But it's good to go through that challenge. So coming into the conclusion, all the children like being in the water. Water and its properties can be used effectively to promote recovery and independence in neurodivergent children. And let us use the magical power of water to heal children with disabilities. This should be your take from this session. And thank you so much. And if you have any questions, you can put it in the question answer session, or you can put it in the chat box also. Okay, there is one question. What should be the temperature of water? Okay. So the comfortable temperature ranges from 32 to 36 degrees Celsius. It shouldn't be very warm where the child is uncomfortable. It shouldn't be very cold also. So the minimum temperature should be 32 to 36 degrees Celsius. Okay, so I can't see any more questions. So I think that's it. Thank you everyone for finding your time to attend the webinar. Thank you so much. What should be the pH? Okay, there's one more question. What should be the pH of water? So the ideal pH is 7.2. It shouldn't be more alkaline. It shouldn't be too acidic. So 7.2 is the ideal pH where we should maintain. We should check it daily before taking the patients every day. The pH might alter after each session or after all the sessions if you're taking like a client from 4 to 8. So in the morning and evening, checking the pH is very important, and we have to maintain the uh, pH of the water. Another question we have is what should be the minimum age of the child for aquatherapy? There is no minimum age. We can even take infants in the pool. If you browse through the internet, you can see a lot of small children, like 2 months, 3 months children also swimming by themselves. So there is no age barrier. The only thing is the medical. There shouldn't be any, it shouldn't be harmful for the child in any way. There shouldn't be any other medical issues, any infections, or any such kinds of thing. Ideal situation, ideal scenario, you can take any children. All right, I hope I have answered all the questions. And if you have any further questions or any clarity, if you need more, you can contact me through the Neurogen Instagram ID or email. You can try to get in touch with me. My name is Dr. Arjun, and anytime I'll be available to answer your questions. Thank you so much for attending this webinar, and I hope it was informing some, like it gave you some informations. All right, thank you.